Bismillahirrahmanirrahim. Some of the junior colleagues and junior doctors or even medical students asked me to start sharing stuff about basics of ECG. So today is the first lecture of the basics of ECG. To understand the basics of ECG, first you need to know the normal electrical pathway and the electrical impulse pathway inside the heart. So suppose it's a heart. This is right atrium, this is left atrium, this is right ventricle, and this is left ventricle. This is apex of the heart and this is base of the heart. So suppose here is the sinoatrial node and this is the AV node. So it starts from the sinoatrial node, from where the electrical impulse it gets started. It fires here and spreads throughout the atria and then reaches the AV node. AV nodes in normal circumstances, the only place or connection between atria and left ventricle if we talk about the electrical impulse. And after relaying in AV node for some time, for a few milliseconds, and the electrical impulse is then travels downstream through the bundle of his here, and from bundle of his there arises left bundle branch and right bundle branch. So when the electrical impulse gets fired from the sinoatrial node, it depolarizes the atria. This is the time when P wave is formed, and then it reaches the AV node and stays here for a fraction of time, and the PR segment inside in the ECG corresponds to the relay of electrical current or delay of the transmission of the electrical current inside the AV node. After this bundle of phase, it reaches the bundle of phase and interventricular septum, it gets depolarized. And at this time, when the interventricular septum depolarizes, Q wave is formed and then it travels towards the apex of the heart, and at this time R wave is formed, and eventually this electrical impulse travels back towards the base of the left ventricle and right ventricle, and S wave is formed. This time the left ventricle and right ventricle, these ventricles remain depolarized for some time, and this ST segment corresponds to the duration when they are kept depolarized. After that, repolarization starts and T wave is formed. Why and how these waves are formed? Now I'm going to elaborate it a little. Suppose again this is heart. This side is the base of the heart and this side is the apex of the heart. So please keep it in mind that different leads of the ECG are applied on the body so that negative terminal is towards the base of the heart and positive terminal is towards apex. Now we know that this is heart, this is positive terminal, this is negative terminal. One thing that all of us must know to exactly understand the physics of ECG is the principle of galvanometer. Galvanometer is a device that almost we all have seen, and this one is positive side, this is negative side, and there is a needle in it that remains in the neutral position if it's not connected to any circuit. So suppose we have connected the positive terminal with the towards the base of the towards the apex of the heart, and negative terminal to the base of the heart, as we have already mentioned. So we have to understand that there are basically three principles of galvanometer that are applied in making ECG. First, when positive charge travels towards positive terminal, needle of the galvanometer deflects towards positive. Second principle, when positive charge travels towards negative terminal, needle of the galvanometer flickers towards negative side. The third principle, when negative charge is spread towards the negative terminal, again the needle of the galvanometer is deflected towards positive. So here when we see, and we all know that basically when the electrical impulse travels downstreams from base of the heart towards apex of the heart, base which is negative, we have applied negative terminal towards the base and positive terminal towards the apex of the heart. Basically negative terminal is, you can roughly say that it's the right arm lead, and the left leg lead, that you can roughly say that it corresponds to the positive terminal. So basically when the charge or electrical impulse travels from sinoatrial node towards AV node, basically these are the positive charges that are being traveled downhill. So it's the flow of positive charge from sinoatrial node towards AV node, depolarizing the atria. So at this time we must understand the concept of vector. The vector is, you can roughly say that vector is the direction of flow of the charge. The direction of flow of the charge is towards positive terminal in this case, when the current is traveling from sinoatrial node towards the AV node. So remembering the first principle that I have mentioned of galvanometer, that the positive charge is traveling towards positive terminal, needle of galvanometer will be, suppose this is galvanometer and this is positive side and this is negative side, and we have just attached an ECG roll with it that is moving towards this side at a speed of 25 millimeter per second. And suppose this current that travels from here sinoatrial node towards the AV node, there is, the vector is towards the positive terminal, and when positive charge is traveling towards the positive terminal, this needle will deflect towards the positive side. And suppose we have attached a marker to this needle, and this marker is connected to this ECG paper, right? I'm drawing all these things to make you understand how these markings of ECG waves are formed on the ECG paper. So suppose when the current is traveling from here, from the sinoatrial node toward the AV node, this needle deflected a little towards positive side of the galvanometer, and it actually, if it's not moving, it would have just drawn a line here, a straight line, but as it's moving, as the paper is moving, it's just not just a straight line, it draws like this. So to clear the things, this was our galvanometer, and up till now we have discussed that we have drawn this P wave, and we had reached the AV node. After reaching the AV node, the electrical impulse stays there for some time, but this ECG roll is continuously moving, suppose in the left direction here. So the marker that is attached to the needle of the galvanometer will stay in the neutral position, so a straight line will be made which corresponds to the PR segment. So after that, when the current starts moving from the AV node to bundle of His, first thing to be depolarized is interventricular septum. And one thing we all must remember, that interventricular septum is depolarized something like this. It's depolarized from the left bundle branch, and it gets depolarized from in this vector. So the vector is towards the negative terminal. Now remember the second principle that we have mentioned, that when positive charge or the current of depolarization travels towards the negative terminal, there is the deflection of the needle of galvanometer is towards negative side. So if there is ECG, this is ECG, P wave we have already discussed, it has been formed, then PR segment. So if this vector is towards this side, it's towards negative side, this negative side, so it will be deflected towards negative here, and as it deflects for a very short time, so a very small physiological Q wave is formed. After this Q wave is formed like this, after this Q wave is formed, our electrical impulse travels through the left bundle branch and right bundle branch towards the apex, and the net vector is again towards the positive terminal. So now if the net vector is again towards the positive terminal, and we again remember that principle, when the positive charge is traveling towards the positive terminal, again the needle will deflect towards positive side, and here R wave will be formed. So you can observe that in case of P wave it was also deflected towards positive, and in case of R wave it has also been deflected towards positive, but P wave is shorter than R wave. Why? Because P wave is formed by the contraction of atria, and R wave is formed by the contraction of ventricle. In case of atria, vector, although its direction is same, but it's small, or it's relatively weak vector. In case of ventricles, here, in case of ventricle, as myocardium is thick, there are more cells inside the myocardium, there is more current that is being passed, and a relatively heavier, stronger current is being passed from base towards the apex, and that's why there is the stronger vector towards the positive. That's why our needle, in case of P wave, it deflected almost here, but in case of this strong vector associated conduction, it will be deflected here. So as it's deflecting more towards positive, so a taller R wave will be formed. Now, after reaching the apex here, as we have already mentioned, the charges start traveling again towards base of the heart. So again, remember the principle of the galvanometer, the second principle of galvanometer, that these positive charges are traveling towards negative terminal. So P wave has been formed, Q wave has been formed, we have discussed, R wave has been formed. At this time, when this current is traveling towards base of the heart, another wave is formed, and this is called S wave. And after S wave, the whole ventricles, both right and left ventricle, they will be kept depolarized for some time, and this is the time when ST segment is formed. Now we have discussed that ST segment is formed when ventricles are kept sometime in depolarized state. After that, basically repolarization starts, and we must remember that repolarization starts from outer side of the ventricle towards inner side, like this. The repolarization direction is like this, and by repolarization we actually mean, suppose these are ventricles, we actually mean that it's again being charged as negative, first from the outer surface towards the inner surface. First the outer surface is repolarized, and then the inner surface of the ventricle is repolarized. So what we see here, that actually it's negative charge that is being spread in this direction. This was the apex, and this was the base, from outer surface or this surface towards this surface. If we draw a net vector, it will be like this. So again, remember the third principle of the galvanometer, that when negative charge spreads towards negative terminal, remember that we have applied the negative terminal towards the base, and the direction of our vector is this, and what this vector carries is the negative charge. When this negative charge is spreading towards the direction of the negative terminal, again there should be a positive deflection of the needle of the galvanometer. So again, suppose this is our P wave, Q wave, R, S and ST that we have already discussed. Now it again deflects towards positive, and this roll is moving, and again this wave towards positive side is formed, and what we call this wave, we call it as a T wave. So up till now we have learned that how P wave is formed, how a small Q wave is formed, how R wave is formed, how S wave is formed, and how T wave is formed. In next video, I'll be discussing some details about leads. Usually we have a 12 lead ECG, and what these leads mean and where they are attached and from which direction these leads look at the flow of the charge. Thank you very much.